Hello, everyone. Are you constantly sneezing, dealing with a stuffy nose, or just feeling like your sinuses won't clear up? You may be wondering, do I have allergies, or is this just a cold? And most importantly, what's the best way to get relief? So today I'm going to talk about the difference between allergies and colds and share the most effective treatment plan to help you breathe easier in this season. I'm Dr. Lola Ashaye. I'm a board-certified family medicine and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or your loved ones have been putting off healthcare due to frustrations or you're seeking a more personalized approach to your health, I invite you to learn about our membership program. We're dedicated to making high-quality healthcare both accessible and stress-free. But let's get started. Don't forget to subscribe, share this with a friend, and if needed, book a visit with us to start your health transformation. So, how do I tell the difference between allergies and a cold? So many people mistake allergies for a cold because the symptoms are actually very similar, especially in the beginning. But there are some key differences. The first one is the length of symptoms. Allergies can last weeks or even months. They pretty much last as long as you're exposed to the allergen. So whatever it is that's triggering your symptoms, as long as you're exposed to it, the allergies will continue. Colds, on the other hand, will last 3 to 10 days. Many times the symptoms will be worse the first by day 3 and 4, and then starts to get better after that. The other thing to think about when you're trying to determine the difference is how quickly the symptoms come on. Typically, allergies just suddenly come on after exposure to whatever it is that you're allergic to, like pollen or dust or pets or mold. Colds, on the other hand, tend to be gradual. So you may start off with mild symptoms initially, and then over time, as the virus increases in your system, multiplies in your body, you start to have more symptoms. Another thing to note is the symptoms. So many times with allergies, you tend to have more sneezing, the discharge from the nose tends to be more clear, and then itchy. A big aspect of allergies is itchiness. Many times people have itchy nose, itchy ears, itchy eyes. With colds, don't usually have as much sneezing. You may be congested, but a lot of times it's thicker mucus with colds rather than clear discharge. So other things that can help you differentiate between allergies and colds is whether or not you have a fever. Typically with allergies, you don't have a fever. Many people would not have body aches, but sometimes people have fatigue, like they just feel so tired from being congested with allergies. Versus with a cold, you could have a fever, you may have body aches, you also could feel tired with a cold. So another easy way to tell if you're not sure is depending on what medications that make you feel better. So if it's safe for you to take antihistamine or use a nasal spray, or maybe when you notice when you avoid whatever it is that you're suspecting you're allergic to, you get better. That's more consistent with allergies versus a cold. Antihistamines may help a little bit with the symptoms, but you usually get better mainly with rest, with keeping hydrated, and with decongestant if it's safe for you to take. So an evidence-based study showed that, and this is in the Journal of Allergy and Clinical Immunology, found that 40% of people misdiagnose their allergy symptoms as cold, and so they choose ineffective treatments, and so they continue to have symptoms. So if you are not sure, you can always go see your doctor. And if you're in the Sugar Land area, we're happy to help. We do video visits too. All right. Now, what can I do? So say you've decided based on what we just talked about that it's allergies. What is the best treatment plan? Well, the very best treatment plan is to avoid the trigger. So with pollen allergies, for instance, which is very common and which is very prevalent right now in the Houston area, some of the things you can do to avoid the trigger is keep your windows closed. If you've been outside, you want to shower right after you come indoor. Hair can be a great mop to trap pollen. So you want to wash your hair. If you have pets, you want to make sure that they're not bringing in pollen. So really do all you can to avoid the trigger. You can use a pollen mask. You can use an air purifier. So just whatever you can do to try to lower your exposure to pollen will be helpful. If you have a dust mites allergy, you may want to wash your bedding weekly and you want to use hot water. You want to use allergen-proof pillowcases. If it's pets, you want to try and keep the pets out of the bedroom and areas that you're spending a lot of time in. You want to vacuum with a HEPA filter. So those are some things you can start to do. Avoiding the trigger is certainly one of the best things you can try to do so that you don't develop symptoms in the first place. The other things that can be helpful are medications. So in 2020, there was a Cochrane review study that showed that nasal steroids are the most effective treatments for allergic rhinitis. They're more effective than antihistamine alone. So using nasal steroids like fluticasone, which is Flonase, triamcinolone, which is Nasacort, mometasone, which is Nasonex, they work to reduce inflammation so that it reduces stuffy nose and sinus pressure. So that is probably the one with the strongest evidence. The other things that can be pretty helpful are non-drowsy antihistamine, especially for people with sneezing and itchy eyes. And so doing something like cetirizine, fexofenadine, loratadine are all good options. Cetirizine is maybe a little more fast-acting. Fexofenadine is great for outdoor allergies, and loratadine usually is less drowsy, is a good less drowsy option. So just finding what works for you. And sometimes you have to switch them around depending on your current lifestyle or just whether it's working for you as much as, or not anymore. The other thing you can do, which I find actually is been super helpful in my patients with allergies, is the saline sinus rinse for those that can tolerate it. And that is a natural decongestant. Pretty much you're flushing out allergens and it reduces swelling. So using a sterile technique with distilled or boiled water is helpful. And there was a study in JAMA that showed that nasal saline rinses improve allergy symptoms by up to 50%. So it's a huge, it's a great way to really, really help allergy symptoms. And some people have trouble doing it, but really, if you take the time to learn how to do it properly and get it done, it really does help. The other thing that could be helpful is doing an oral decongestant. But with this, you do have to be careful because sometimes if you use it for too long, it can cause rebound congestion. So I'm talking about things like pseudoephedrine, generic like Sudafed. It does help and it's great for severe congestion, but you don't want to use it for more than 4 days. So just being, aware of that. So what if you've tried all this stuff and you're still struggling with allergy symptoms, or you're having to use allergy medicine all the time just to keep your symptoms at bay? Well, you may want to start thinking about a longer-term solution, like getting tested for your allergies and doing allergy immunotherapy. So allergy immunotherapy usually are allergy shots or allergy drops. And basically, you're training your immune system to stop overreacting to allergens. And evidence show immunotherapy can reduce allergy symptoms by up to 80%. And so it's a great option for people that are struggling. There are other medications that can be pretty helpful with allergy as well. Some people may need prescription medication like montelukast, which helps with both nasal allergies and asthma-related symptoms. Sometimes we need more prescription strength nasal spray, but there are options for allergy treatment. So if you're tired of dealing with allergies year after year, don't wait, get relief. You can contact us at InTouch Primary Care. We offer personalized allergy evaluations and treatment plans designed for long-term relief. So if you're interested, go ahead and click the description and schedule an appointment with me and take control of your allergies today. I hope that helps.